Hey Montreal brides, I wanted to take a quick break to announce a giveaway. Imagine walking into a room filled with all the inspiration, vendors, and ideas you actually need to plan your dream wedding. That's exactly what's happening at the Elegant Wedding Bridal Show on Sunday, November 2nd, 2025, right here in Old Montreal. I'm giving away 4 lucky couples 2 free tickets to the show. All you have to do to enter is head over to our Instagram at Wedding Wednesday Pod and find all the instructions on our pinned video on our account. We're closing the giveaway on October 9th, 2025, so don't wait to enter.
They called me in panic, like on Monday, weddings on Saturday.
Yeah.
And she had a bridge in front, and the bridge popped out.
Oh my God. How early should a couple come in for a consultation in regards to their smile?
We have a common joke we tell our patients, we say if you floss and brush your teeth in the morning, you'll keep your friends. If you want to do it once a day, but if you do it at night, you'll keep your teeth.
What causes bad breath? Would you say vaping also affects?
Absolutely. When you're talking about toothpaste whitening, you got to make sure that there's not like
Charcoal toothpaste whitens teeth without damaging the enamel.
I personally saw a case done at an esthetician where the patient come, major pain, gums completely burned, and that was actually just before her wedding.
Welcome to Wedding Wednesday, the podcast that's about to spill all the tea on what it's like to plan a wedding from the bride's perspective and all the details no one talks about. I'm creating the podcast I need to keep me sane and feeling less alone as I plan my own wedding. We're diving deep into the hilarious, messy, and sometimes crazy world of wedding planning and wedding horror stories. Get ready to laugh, cry, and maybe feel a little less alone in this wedding planning madness. Hello. Welcome back to Wedding Wednesday. My name is Adrianna, and today's episode, we have a dentist on the podcast. We have Dr. Ziad Rjeily, who's here to talk to us about how to ensure that we have the best, perfect smile in time for our wedding. Before we dive in, I'm going to ask you to please subscribe, rate the podcast, send us a review. I would love to know some feedback on how you've been enjoying our podcast. And with that, let's say hello to our guest today. Hi, Ziad. How are you?
I'm great. Yourself?
I'm good. Thank you. Welcome to Wedding Wednesday.
Thank you for having me.
Of course. To kick things off, I always love to ask my guests, where did you get your passion from? Tell me how you got your start in the dentistry industry.
Yeah. I was really interested in the profession and going to the dentist when I was young.
Yeah.
And that's it. I wanted to work with patients and helping them out with smiles, with everything going on with their teeth. So
So you decided to commit, you studied, you did the whole thing.
Yeah.
And then you started your career.
Yeah.
Did you start with your own practice or did you learn from another?
I was fortunate enough to work with a colleague who had more experience. And after a few years, we decided to open an office. And I've been a dentist for the last 30 years.
Wow.
Passes very fast.
Yeah.
Yeah.
A lot of knowledge I'm sure you have acquired. I'm so excited to ask you all the questions.
Nice.
So when it comes to a big event, something like a wedding, what would you say is the number one misconception people think about when they think about their teeth?
I find that they come to consult us a bit late.
Okay.
They should not wait. They should come and consult early.
Yeah.
Because of depending of their dental health, their expectations of what they want for their wedding day. We don't want like any emergencies that day. We want to have time to build the smile they want if they want to go into big cosmetic dentistry, but it takes time. So don't like give us just a few weeks or a few months because sometimes it takes way longer.
Okay. So how early should a couple or even sometimes the parents of the children getting married come in for a consultation in regards to their smile?
Well, I would recommend them to go consult their dentist every 6 months. Usually that's our recommendation, cleaning and exam. Because before starting to whiten teeth or reconstruct their teeth, we got to make sure that everything is healthy. So if you have cavities, gum disease, sometimes we find tumors.
My God.
We want to jump on that ASAP. So once that is really fixed, because we can't just do aesthetic dentistry and forget about, let's say, cavities on the back teeth, or if you're having infections somewhere, we got to treat them. So, go consult as soon as possible. Tell us when your big day is, because it could be, yes, for a wedding, but it can be for any other occasion, because everybody wants now aesthetics, right? So, and the face represents like about 40% of your whole face, the smile, sorry. So, it's good to go consult as soon as possible.
Okay, so you would almost say, from what I gather, as soon as you book your wedding day, you go in and you start to discuss that with your dentist.
Yes,
Okay.
your expectations, what are you looking for? and then we can like have time to, because sometimes what's long to do is the planification on our side without even having the patient with us. So we discuss with the lab. We do actually your case, if it's a big case like rehabilitation, I like to do these cases on a model before I even touch the patient's teeth. So I could show him, we're talking about big cosmetic cases. Before even showing him, I do all the work on the model. Then I show it to him, and if he likes it, then we can reproduce it identically.
Okay.
But we don't want to like do the treatment, give him what we think is nice, and then his expectation are, this is not what I was looking for.
Right.
And it's a disaster. So
does that ever happen where?
No, because we plan our cases well in our office, and I suppose in all the offices in Quebec.
Yeah.
But
okay. So everybody has, their own personal preference when it comes to their teeth. You've got somebody who just wants to whiten their teeth. And then you have the person who wants to get braces or Invisalign to make sure that they restructure their teeth on time, if you will. So, but what is the average wedding request most people come to you for?
I would say making sure that they're healthy. I mean, you don't want to have an infection on your mouth the day of your wedding, right?
Yeah.
Doesn't mean we can drain it and the next day you're fine.
Yeah.
So that's number one. They don't want to have bad breath.
Yeah.
No pain, and aesthetically, a nice white looking teeth. Sometimes their teeth, they need reconstruction. So then we got to discuss with them all the different options. Some are quick, some are take a long time. If you're talking about Invisalign or ortho, that takes longer.
Right.
Takes maybe, I don't know, average a year and a half. Unless you want to do just the front, we can do it like way quicker. So depends of like different situations.
What you want to do. Okay. What about like teeth whitening? How early should you do that?
I would recommend also as soon as you can, because, you get to whiten. Some patients, in general, after a few applications, it's going to work well, but we'll recommend them to go like do the whole process, because after a certain number of weeks, it's going to stabilize the color. So you'll go to like very white, and then it's going to stabilize a bit, like back up a bit in color-wise. But then if your wedding date is coming up, then you do just a little retouch a few days before, and
you're good to go.
Yeah, but some people it's like months for getting the result they want. If they have stains, like white stains, from fluorosis, or then it takes longer applications, way more applications.
Okay. You talked about infections.
Yeah.
So some people come to you, let's say I'm your patient and I come to you and I want to whiten my teeth in time for my wedding, but I happen to have an infection.
Yeah.
Would you say most infections are preventable with at-home hygiene?
Most. Sometimes it's like related to semi-erupted teeth, like wisdom teeth. So that you could try to brush, you can try to keep it clean, but it's like almost impossible.
Okay.
So bacteria will grow around those teeth, and it's hard to keeping these gums clean. So sometimes we need to remove these teeth. But most of the infections or cavities are preventable, absolutely.
Okay.
If you follow the recommendations we give.
Let's talk about the recommendations for at home. Sure. Just like generic everyday, like just making sure you have good oral hygiene. What does that look like at home for the average person?
Average recommendation for the average person would be to brush and floss 2 to 3 times a day. Doesn't take much time. We ask for brushing for about 3 minutes, and flossing before or after the brushing doesn't really matter. People like brush more than floss, but it's a mistake, because most cavities we'll find are between the teeth where your toothbrush won't reach. So you got to remove those bacteria, and to remove them you need to floss minimum once a day. And we can tell when minimum once a day. But if you do it once a day, you're pretty much going to be safe.
You're okay.
Yeah, but do it maybe twice a day.
You recommend twice a day, but the minimum is once a day of flossing.
Yeah, let's say in the morning after you had breakfast. So you brush your teeth, you floss, then you go around with your day. And at night after you had your last, not just dinner. If you have a habit of, let's say at 9 o'clock to munch a bit before you sleep, that's when you should brush and floss right after. So you get to sleep without any food inside your mouth, because when you're sleeping, you have less saliva. So there's more risk of bacteria's growth and growing and converting the sugar in your food into acid, which will attack your enamel.
Is it a misconception that if you do floss once a day, that it's better at night than in the morning? Or is that not a misconception?
It's actually right.
It's true. Okay.
Because once you're sleeping, once again, you'll salivate less. So they say we have a common joke we tell our patients. We say if you floss and brush your teeth in the morning, you'll keep your friends if you want to do it once a day. But if you do it at night, you'll keep your teeth. So
good to know. That's so
from the saliva flow.
To be totally transparent and like out myself, I am a morning flosser.
Okay.
Because first of all, I didn't know I should do it twice a day, but when I do it, it's in the morning, and that's because by the time I get to the evening, I get too tired.
Yeah.
So I figured once in the morning is better than none.
Absolutely.
Yeah.
I agree. But try to do it maybe at night before you're too tired.
Okay. Yeah, so this is better.
If once you're tired and you're ready to go to bed, you're not going to want to go and do that routine.
Fair. When I was younger, I had braces, and obviously flossing with braces is a whole other thing. And now I have a wire behind my front and my bottom teeth.
Okay.
So I floss with the loop.
Yeah, absolutely.
Yeah, I do the whole thing. But there was a period when I had braces that I wasn't flossing at all because it is such a headache to floss when you have braces. So then what happens with that? I started developing cavities.
Okay.
But my dentist had said it's early enough that it's reversible.
Absolutely.
So what is the science behind reversing the cavities like that?
Yeah, that's for the last few years, we're trying not to repair your cavities. We're trying to reverse the pathology of cavities. So what we do is because cavities is basically diminished mineralization of your tooth, of your enamel or your root. And what we try to do is remineralize it instead of taking the drill and do like we used to do back then, taking out the cavity, we're creating a hole inside your tooth. Then we fill it, right, with fillings, different type of fillings. But the problem is that all these things, they have they'll last for a few years, let's say 10 years, 15 years, depending on your hygiene once again. Because if we repair your cavities and the patient doesn't fix the problem that brought those cavities, not flossing, not brushing enough, well, the fillings won't last as long as they would if somebody takes care of their teeth, like we say. So if you do follow our recommendation, we're going to remineralize your teeth. So we're actually going to recommend you certain type of, let's say, toothpaste that are really rich in fluoride. And we'll tell you how to brush. Like you brush for 3 minutes, then you spit, and we're going to ask you not even to rinse your mouth for 30 minutes to let the fluoride remineralize your enamel. Yeah, so we could stop these cavities. Okay. So it's not like before where we used to just take the drill and fix it. We try to reverse it and prevent any new ones. And it works.
Wow.
Yeah.
Okay. So that's good to know when it comes to the at-home oral hygiene every day. Let's say the average person is doing that and they come to you, they're a little behind on coming to you on their consultation. They're coming to you a month before their wedding.
Absolutely.
They want to do the maximum that they can to make sure their smile is the best in time for their wedding. What would you recommend with 4 weeks to go for the wedding? What kind of things can we do?
Yeah. Well, first of all, we got to make sure that, I like to start with a good cleaning and exam to really know what's going on in my patient's mouth. Sometimes they come in just for a consultation because at our office, we give free consultations for aesthetic cases, implant cases, reconstructive dentistry. But when they come, we do the consultation, but they need to come back for a full exam. If they had a cleaning recently at their dentist, well, we don't need to redo the cleaning, but we need to really know what's going on in their mouth. So that's it. So if within a month, we need to do the exam, cleaning if they didn't have one, so the gums are nice and clean, no bad breath smell the day of your wedding. And then if they really want to try to fix aesthetically, then we got to see if they have cavities. Well, we're not going to recommend maybe to whiten unless we fix the cavities because the products we're going to use are strong. They're not off the shelf or what you could order online. They're professional products. So concentration wise, why do they work better than off the shelf? It's because they're stronger, right? And we get to give them to our patient because we know their dental health before we give it to them. We don't put them at risk because these products being used at large by the population without having an exam first can be dangerous for your gums. We've seen horror stories done, let's say, in other offices, not dentists, estheticians, they do it and stuff like that. But it was even on the news, some people getting like their gums burnt and stuff like that. So we do that. And I mean, it will affect a bit our recommendation. If you tell us my big day is in a month, well, there's some products we can use. Let's say veneers are done with the laboratory. So we got to give the lab time to do something nice. We can't tell them do it fast in five days, because it's like somebody doing a nice painting. If you tell them do it fast, it's not going to be as nice as you tell the artist to do something nice, right? So then we'll most likely try to do it at the chair by us, like composite veneers. It's nice. It can be really nice, but anything that's done fast in general, the world, it won't last as long as if you take your time, especially in dentistry, because it's very, very precise. So, and everybody complains about the costs of dentistry. Well, if you don't want to have to redo it in 2-3 years because we did it too fast, right? So, so sometimes we'll refuse to do big work if we don't have enough time to deliver quality.
So I have a month. Let's say I have a month, and I did my cleaning with you. You did my cleaning. I don't have cavities. Let's knock on wood. And composite bonding and veneers maybe is too last minute.
Composite bonding, no, it's because it's like I do it right away at the chair.
Okay, so composite bonding is an option, and so is teeth whitening is an option.
Absolutely.
Okay, so those are the options for somebody who's like a month out.
Yeah.
Okay, that's good to know.
But I mean, if somebody broke his tooth, let's say you come a month before, you break a tooth, we need to fix it. That's like a filling, or but if we need to extract it, then we're gonna plan a temporary. So it depends of the situation.
Yeah. Okay. Explain to the audience the difference between composite bonding and veneers, because even me, I'm not quite sure what the difference is, or even why people would consider either option. Because I guess I got braces when I was younger, so I like my smile. I need to get my teeth a bit like how do you say? Like, I'd like to get them whitened, but I'd like to get them buffed just to like make sure that like the teeth are smooth. But other than that, I'm like, I like my teeth. Like, I don't want to change them with veneers or composite bonding. But what do people with those requests ask for? Like, why do they ask for those options, and what's the difference between those options?
Yeah, I mean, what I like to say to the patient when I look at their teeth is I'm going to recommend them what's best for them depending of what they're looking for, right? So I like to say you have one ideal treatment plan, and depending of time, depending of costs, if it doesn't meet the deadline, if it doesn't meet your financial readiness to invest in that much work, then we can find other treatment plans, right? So when you talk about veneers, these are done, if you want them nice, they're done through a laboratory. So we fix your teeth, to create the space, even if it's really tiny, like the space that we need. It's more irreversible.
Okay, veneers is not irreversible.
Veneers is not reversible unless there's some cases where you don't touch like the tooth, you just take impressions, and then you glue the veneers on the teeth. So some cases are good for that, not all cases. Composite veneer, it's like white filling, so it's soft. So we just like add it to the tooth, we sculpt it, and we polish it to make sure that everything is so. It's obviously way more expensive. Maybe I would say 2 to 3 times more expensive porcelain veneers done through a laboratory. So that's a big factor. Big advantage though is you won't need to do it anytime, change them anytime soon, because it doesn't change color. It's porcelain. It's highly glazed in an oven, and so color-wise, there will not be any change. So if you come in 5 years and you say, I'd like to whiten my teeth, and let's say, because we have patients with veneers all over their teeth, well, we can't whiten them.
Okay.
So they won't get yellower, but we can't whiten them. Okay. So it's permanent. Versus composite, it will get yellow, a bit more yellow with the years, because they absorb a bit more the colorants, what you eat or drink. But you can't whiten them either unless you take out the layer and you redo it. So speaking of whitenings, when we do a whitening, you're going to whiten the enamel. But you can't whiten crowns, veneers, composite veneers, fillings. If you have fillings that say, let's say somebody has had a few cavities when they were young because they didn't floss or whatever, or even recent. Well, the dentist picked the color of the composite to match your enamel. So if you decide on your own to whiten your teeth, it may work, maybe not as much as professional whitening, but it may work enough for your enamel to become white a bit more, but your filling won't get whiter.
Okay.
So then you smile and we could see the fillings.
Okay.
So then we got to change the fillings. So a patient who comes in and it has a month before their big day, well, we're going to fix the cavities before we give them whitening, but we're going to know where our whitening is going to go color-wise because we have a shade guide. So we're going to say, okay, this patient with experience, we know, okay, he's going to end up in this shade color. So I'm going to do my fillings with that color right away. So when you leave, you may tell me, oh, they're a bit more white than my teeth. Yeah, obviously, because we're going to whiten the rest of your enamel.
Okay.
So it's all a question of experience.
Of course.
Yeah.
In my case, one of my you can probably see it.
Okay.
One of them is more chipped than the other. I don't know. I'll show you after. But my dentist said, because I said, oh, I'd like to whiten my teeth for my wedding. I haven't done it yet. I still have I have less than a year, but I have about a year to do it. So I'm like kind of like delaying it just because. And so but I said, I want you to fix that chip. And this tooth in particular, she can't buff it. She said she has to add a piece.
Yeah, exactly.
So from what I understood, you would whiten first and then add this piece, this composite.
Because we have time.
Okay.
You know?
And not the reverse, so I can match it to the color of the composite, basically.
No, because let's say we lengthen your tooth to the right length.
Yeah.
So it's going to be wider than the rest of your tooth.
Yeah.
And then you're going to whiten. But when we have the luxury of a patient who's not getting married or doesn't have a big day coming up soon and we have time and he's not in pain and, it's not a big fracture, well, we'll whiten first. And once it's stabilized, we'll do the corrections.
Okay, I see. Okay, fascinating. You talked about bad breath.
Yeah.
I want to dive more into that. What causes bad breath? Is it just the stuff in the teeth or does it stem from the tongue?
Also, it can come from your stomach. So a combination of many things. So a lot of patients, when they come to consult us, well, they're coming to see the dentist, right? So we're not a gastroenterologist. So we're going to check the teeth, make sure when was the last time you had an exam, cleaning. We're going to measure the depth of the gums. So if she has gum disease, that can be a cause of bad breath.
Okay.
Yeah. Then you got to check also what they eat. So if they're eating, garlic, onions, then, but it can also come from other, their tongue. But, if you keep it clean, it should fix everything. But you have to floss also because not flossing, yes, it's going to help giving cavities, but gum disease also.
Okay.
Or smokers will be more prone to having gum disease. So even if we do the best of the treatments, they won't work as much in a smoker's mouth than a non-smoker.
I've seen some smokers that have missing teeth even.
That's
how bad I guess it affects your teeth. Would you say vaping also affects?
Absolutely. Okay. Absolutely. When it came out, we weren't sure.
Yeah.
And there was a big publicity around it saying, oh, no, it's natural. And patients were coming and saying, no, I don't smoke, I vape. But we didn't know the results because it was new.
Too new.
So we're saying you know what, we're going to recommend the same recommendation you stop because we like to consider that it's like smoking cigarettes. But now with time, we see that it's as bad as, or maybe even worse. So vaping or cigarettes, it's not good for your gums. You'll have way more chance of gum disease, losing your teeth. Even somebody who invested a fortune in implant dentistry, well, you're going to have way more chances of losing even your implants.
Okay, wow.
So, yeah.
Wow. Do you believe in tongue scraping?
Yeah. It's removing bacteria from it.
Yeah.
So why not? Yeah.
You're okay with it?
Yeah, absolutely.
Okay.
The ENT doctors, there was a moment, I don't know where they're at because I'm not an ENT doctor, but they were recommending not to brush your tongue to make sure that you're not pushing the bacteria deeper.
Right.
Instead of.
Okay.
But I recommend my patients to, brush your teeth, spit, if it's not high fluoride, rinse, and then with your toothbrush or smaller toothbrush just to brush, but to the outside.
Out.
Yeah, to get the bacteria out.
Have you seen those tongue scrapers that are kind of like a U shape that are metal? Do you recommend those at all?
I don't really recommend.
You don't. It doesn't. No harm, no foul, basically.
Exactly.
Okay. Let's dive more into the over-the-counter whitening
Yes.
stuff. So the popular ones that I can think of off the top of my head, there's the Marvis toothpaste and there's the Crest White Strips.
Yeah.
And then there's a multitude of other whitening toothpaste over the counter you can buy. For my engagement party, I had a month before the engagement party. I didn't think I would have time to go to the dentist, whiten my teeth. I bought the Marvis. I used it. I was like, I don't know if it's going to work, but whatever. I used it. And I noticed that after about a month of consistent use, it did get me a bit whiter, but it was definitely a temporary solution. And I would have had to keep using it to maintain that white, first of all. And second of all, it would never get me to the white that I think at least a dentist can get me.
Exactly. That's for sure.
So, first of all, is it safe to use these over-the-counters?
Yeah, I mean, it's safe because anybody can buy them, right? So they can be strong enough to whiten as much as we'd like, because if you use our products, they will be dangerous if you use them by yourself without proper professional supervision.
Okay.
So the concentration of whatever's going to whiten your teeth is pretty low.
Okay.
And when you're talking about toothpaste whitening, you got to make sure, and I'm not going to go into details of which company, but for different reasons, but you got to make sure that there's not like less fluoride in it, because you want your teeth to become whiter, but you don't want to have less fluoride helping you against cavities, right? So that's one of the things. And also another aspect is you don't want it to be abrasive.
Okay.
So like, there's like charbon and...
the activated charcoal.
Charcoal, exactly.
Is that you would...
I never recommend it, and I actually tell them not to use it because it's too abrasive. Okay. So at the beginning, yes, it's going to clean, because enamel, if you look at it on the microscope, there's little porosities, and that's what whitening does. It will clean that. Okay, but
clean, but does it damage?
No, it won't damage.
Even if you do over the counter?
It depends what. Charcoal, yes, because it's abrasive.
Okay.
There's another one like bicarbonate de soude.
The baking soda.
Sorry.
Yeah.
Also, it's very abrasive. So if you want to use the baking soda, maybe like if you're really insisting and you're asking me how could I use it, but you want to do it and I'm telling you not to do it, like do it maybe once a month, maximum, because we don't want to, what happens is that your enamel is not, there's a certain thickness, and you don't want to resorb it, because the layer under the enamel, which we call the dentina, I think in English, it's more yellowish. So over the years, when you grow older, it gets thickened, the dentin, by the nerve like receding a bit inside your tooth. So the less enamel you have in thickness, the more your tooth will look yellow. That's why in older patients, their teeth have tendencies to be more yellow, because the enamel is not as thick as it was. So you don't want to. I mean, aging, usure. You don't want, let's say, charcoal, where you're gonna abrade the. They're too abrasive, so we don't recommend that at all.
Okay. What about the oil pulling? Have you heard of that trend?
Yeah.
Whatever. No harm, no foul again. Like, try it if it works for you, but it won't harm. Okay.
I mean, we're not going to tell the patient, do this, don't do that. Like, I wouldn't recommend it. I personally don't think it works, but I want to do it. Try it.
Yeah. Try it for you. Okay. So the over-the-counter, overall, the ones at least that say whitening toothpaste or something like that is safe to use. Safe to use
if your expectations are not, if financially, and I totally respect that you cannot, it costs, right? It's expensive at the dentist. And I recognize that. But if you don't want to go through that, I mean, try it. If it helps you, like you said, it helps you a bit. It's not what you would dream of having as color. I mean, do it, no problem. Mm-hmm. But I mean, as long as the expectations are real, you're not gonna get like and they sell so many of them. They're not at risk because they're not strong, the concentration. So there's no problem in doing it. But eventually, I mean, if you're gonna go more, it's gonna take a real professional way. Okay.
Hey Montreal Brides, I wanted to take a quick break to announce a giveaway. Imagine walking into a room filled with all the inspiration, vendors, and ideas you actually need to plan your dream wedding. That's exactly what's happening at the Elegant Wedding Bridal Show on Sunday, November 2nd, 2025, right here in Old Montreal. I'm giving away 4 lucky couples 2 free tickets to the show. All you have to do to enter is head over to our Instagram at Wedding Wednesday Pod and find all the instructions on our pinned video on our account. We're closing the giveaway on October 9th, 2025, so don't wait to enter. Would you say there's any risk of discoloration at all? Because I've seen where sometimes a tooth on somebody, they have in tache. What's tache?
Stains?
A stain. Yeah, a stain. Like, I think they're called milk stain. I'm not even sure what they're called really, but a stain on the tooth, and then you put a Crest wipe strip, let's say, and it like accentuates the stain.
Absolutely, yeah.
So is that a risk using these?
It's not a risk if you. That's the thing. If any situation a bit more complicated as a patient with like just a bit yellower teeth, let's say with these white spots, white stains, or fluorosis sometimes does that. The problem is that when you put the whitening agents, and we know it when we start the case, and I tell my patient, one person comes to mind, it's the wife of a friend of mine. I told her, I said, yes, we can whiten your teeth, because a lot of dentists, I told her, you can't because of that. And they would start, or if you would try it becomes so white that she'd stop, right? Because it makes even worse the contrast.
Yeah.
But what I told her is, I said, listen, the only difference with you is you're not going to use, let's say, 1 set of whitening. You may use 4. Okay. So she did her whitening. I think it took her like 2 months. Okay. But at the beginning, I had warned her, it's going to get really weird because your white spots are going to get so much whiter. But at a point, they won't get whiter because you can't go whiter than that. And then the rest of your enamel will start to whiten till it reaches that white spot. Okay. So she was super happy at the end. And I mean, I did this case about 5 years ago, and we never had to retouch it because it got so white. Yeah. That even if it got a bit yellower, she didn't even notice. So.
Okay. And this doesn't hinder, or accentuate like receding gums, for example, whitening?
Not if it's well done.
Not if it's well done. Okay.
Like, I mean, if when we do it, we make sure that, les gouttières, sorry, I don't know the word, the plastic mold, that we provide with the whitening gel, that it's cut in a way that we contain the gel on your enamel. We're not trying to whiten your gums, or you know what I mean. So if it's well contained, it's going to act no problem. But that's what happens sometimes. We see. I personally saw a case done at an esthetician where the patient comes, major pain, gums completely burnt. Yeah. And that was actually just before her wedding.
Oh my God. Yeah. How did you fix that?
There's nothing to fix.
There's nothing to fix.
I can't help her. It's burnt. You got to let.
Did it look aesthetically bad?
I mean, if she smiles, yeah.
Oh my God.
Yeah, that's like horror stories. But in 30 years, I saw many, right? So yeah. So that's why it's, you gotta. But they don't have access to the ones we have. But even with lower concentrations, situations like that can happen. Yeah. Okay. So it has to be well done.
So you should definitely go to a dentist to get this done, not an.
And I'm not trying to promote my industry, No, exactly. But that's the reality.
Yeah. Okay. How many other horror stories have you seen like that for weddings?
Other situations where, let's say one comes to mind where she wanted to fix her smile. She came like about 6 months before, asked me, this is what I want. I looked, I said, yeah, we can do it 6 months, no problem. Deadline is perfect. So we whitened the teeth. We were fixing everything. So I wanted to keep her on temporaries for a certain while for the gums to heal, because we don't only fix teeth, right? We fix also the gums. So everything looks nice and natural. And so my deadline, I don't remember, let's say the 14th of September was her big day. So everything was going accordingly to that. And so she came to see me in March. We started the work, and beginning of June, she comes to see me. She's like, just to ask you, I know I talked to you about September, but would it be able to move earlier the date? I'm like, to when? She said, July. I'm like, what do you mean July? You're moving your wedding date 2 months before? It's not easy for me. She said, no, actually, I have my engagement party. We're going to take pictures, and my pictures are going to be exposed on my wedding. So I said, okay. So I switched her temporaries to a lab done temporaries, so it was like nicer.
What do you mean by temporaries? The veneers or bonding?
The temporaries, like between getting the real products.
Okay.
So let's say in her case, we had like the surgery.
Yeah.
So I wanted the gum to heal, and aesthetically, I was trying to provide her something nicer in the meantime.
Yeah.
So I did temporaries that I did myself on the chair, like composite veneers.
Okay, something like that.
Exactly.
Okay.
But the lab can give us something more
better,
nicer aesthetically and glazed and everything. So I was able to talk to the lab, get the temporaries done from the lab, put them in for her engagement party. But so that's not planning well, but on our part, yes, but she didn't tell me that detail, which is super crucial for us. So we're able to give her those temporaries for her wedding engagement party. And it turned out to good because right after I was able to finalize her case, and I mean, it was a positive outcome, but we don't want like surprises, right? For on our side. And there's another one that comes to mind. There was the mom of a friend who was getting married, and they called me in panic, like on Monday, weddings on Saturday.
Yeah.
And she had a bridge in front, and the bridge popped out.
Oh my God!
Done like so many years ago in another country, and so when she came, they said we just want to cement it, but it wasn't de-cemented; it was broken.
Oh, okay.
So then it wasn't the same. It wasn't just putting glue and putting back in. I had to do root canals on both broken teeth.
Oh my God!
And then she begged me to reuse her bridge, but I had to empty everything that was broken inside, and then having to reconstruct the tooth to fit that bridge.
Oh my God.
So, and it was a temporary solution till after the wedding till we do the real bridge.
Yeah.
So anyway, so I started that week, we did that, and I remember because I was at that wedding. So in church and at the reception, I was like, please let it not fall out because I'm going to look like an idiot here,
Yeah.
Even though I couldn't cement it permanently because I wanted to be able to take it out in a few weeks.
Yeah.
So I was like nervous the whole time. It was pretty funny.
God.
Yeah. And actually, it didn't pop out, so I was fine.
God.
Yeah.
Was she being warned ahead of time that like, hey, maybe you should relook at this before the wedding?
Yeah.
She was, and like people ignore.
And I respect that. I mean, it's not everybody's ready to do all what we're going to recommend.
Right.
Some people do their treatments like in other countries. They come and the costs here are way more expensive than tourist dentistry or in other countries. So
yeah. Oh my goodness. Is there a way to like, if let's say my tooth just like, do you know Hilary Duff, like the singer?
By name.
I'm sure your girls know. Anyways, yeah. So Hilary Duff, when she got married a few years ago, her tooth broke like a day or two before her wedding, if not the morning of the wedding. And so I don't know what happened, but she had to like rush to get it fixed, and she got it fixed. But if that happened to you, like your patient called you and said, Dr. Rjeily, I need help fixing my tooth the morning of the wedding. What do you do? How do you fix it like that? Like,
well, first of all, in a situation like that, we'll come into the office, even though the office is closed, let's say on a Saturday. That's for sure, because I mean, it's an emergency. Depends of the situation.
Okay.
Sometimes we're just gonna re-cement something or use composite veneers, but sometimes the tooth broke and there's nothing you can use to give you retention. So we got to go in the canal, do a root canal, then put a post, then reconstruct around the post. So dentistry is very large. So it depends of the type of fracture.
Yeah. And what time? How much time would it take to do like a root canal and making it look like it's a brand new tooth, all that stuff?
I mean, I've been doing it for 30 years. So my efficacy at the chair is maybe faster than somebody who just graduated. So it won't take me as much time. It depends on your dentist, how efficient he is at the chair. But I mean, a patient like that doing a root canal and the post and reconstruction would be 2-hour job. So, I mean, if the wedding's in half an hour, she's going to go to her wedding without the tooth, right?
No.
But yeah, I mean.
Oh my God.
Unless you can postpone the wedding of a few hours.
Yeah. Oh my goodness. Is there something you would suggest people avoid? Like, is there a way to eat to avoid this or no?
Well, yeah, not eating too many things that are too like dur, like hard.
Hard, yeah.
Yeah, like pain baguette. Some are like soft, but some are like you gotta. Yeah, these are more at risk. Depends on your situation. I mean, if you had braces and nothing broke major, I mean, eat what you want, and chances are it won't break. But if you have some patients, we treat them and we tell them, listen, don't eat anything too strong. Or if you're in a temporary stage, well, if you eat something that's too strong, it may break. If you eat something that's too, let's say, cabane à sucre with the la tire, that's too sticky, you're going to pull it out.
Okay.
So these cases, even when they floss, instead of flossing and, in and out, we'll tell them floss and pull it to make sure you don't pop out the temporary. So.
Oh my gosh. Wow. I want to completely switch gears or go back to something that made me think of sensitive teeth. Are some people more prone to sensitive teeth than others?
Yes.
And how would you be more prone? Like, is there
let's say receding gums.
So is that genetic?
No, I don't think so. I think it's more like maybe a habit of brushing your teeth too strong, so your gum gets hurt and recedes. You were talking about braces. Let's say some of the times, I'm not an orthodontist, but some of the times or most of the times they'll gain space if you have crowded teeth by like expanding. So sometimes your root can go a bit minimally outside the bone envelope, so your gum could recede. If the bone goes, recedes, then the gum needs bone under it, so it could recede. So, or if you brush too hard, if you had the history of gum disease, because then there's swelling inside your gum. So when we fix it, it's gonna shrink because it's becoming healthy. So then your roots are more apparent. So if you brush your teeth or eat something too cold or too hot, it could bring you more sensitivity.
Okay.
We'll recommend you some toothpaste. Sometimes we'll put in some liquids at the office to try to block these pores because there's no enamel on the roots.
So the sensitivity comes from the roots and not from the actual tooth itself.
But that's it. If you have let's say deep cavity, deep fillings close to your nerve, yes, that can also stimulate the nerve. So
okay, that's good to know. And you have a treatment to recommend, like products and such, to help with the sensitivity.
Yeah.
Okay.
Yeah. But sometimes it's also you have sensitive teeth. Try this to help you a bit, but it may not fix it. We're not going to start doing root canals at large on all their teeth. It would be too excessive. So.
Teeth thinning, is that a thing?
What?
Teeth thinning. The thinning of the tooth, is that a thing or not?
I wouldn't do it.
Does it happen to people? Can it happen?
What do you mean?
Where your tooth becomes thinner and thinner?
Oh, yeah. Okay. No, I thought you were asking if we do this for patients.
No.
Okay, no.
Does it ever happen where a patient comes in with thinner teeth by accident? What would you say causes that, and how can we prevent it, if anything?
It's actually not by accident. It's mostly by excessive acid. Okay. So either acid reflux or bulimic patients or, so I heard
also soft drinks.
Absolutely. Yeah.
Thin your teeth.
Yeah, absolutely. Because it's the acidity in them. And it depends what type of, how do you drink it? Let's say you drink, in the morning, whatever, in the afternoon you like to drink, let's say one soft drink. But let's say at 1 o'clock you open it, you drink it, 1:05 you're done. Okay, whatever. But if you have it there and you sip it for 2-3 hours, that's hell.
Really?
Yeah, because you're constantly putting acid in your mouth.
Wow.
Yeah. So even kids when they're toddlers and let's say they have their biberon and if they drink and it's finished, that's not bad. If they drink a little bit or they sleep with it and once in a while they'll take a bit inside, then the sugar level is worse. So
So this comes from the acid in the soft drink or the sugar or both? Because there's some seltzers that don't have sugar, right? But there's still, like Perrier, for example. It's carbonated water. Is that just as bad as like a 7-Up, a regular 7-Up?
I'm not an expert in it, but I would say it a bit less bad. Okay. But it, sometimes some of them they add let's say lime inside as and then or some people. There was a trend also. People would put let's say water in their fridge and they would put pieces of lime. Yeah, that brings so you're drinking acid. Okay. So we tell them to stop because we see the change from patients that we've been seeing for ages every 6 months, and all of a sudden what's going on? Are you? And then we question them. Oh yeah, I've been doing this. Okay, stop it. Now they put cucumbers instead, just to it's a. But it's anything that they say sugar. It's the bacteria that's going to convert the sugar into acid. So anything that's like that.
Interesting. What about teeth grinding? at night.
Yeah.
Does that also thin the teeth?
Absolutely.
Okay.
Absolutely. So we recommend like occlusal
Mouth
plates.
guard. Okay.
Yeah.
What is that? Is it...
The mouth guard.
Okay, yeah.
So you will grind the guard
mouth guard.
instead of your enamel. And every 3-4 years, whatever, 2-3 years, once we see that it's really worn down, we change it.
Okay.
Some people come and see us and they're, it aged too fast. What's going on? We're like, yeah, that's it. I'd rather see this age than your enamel.
Is it stress that causes mouth teeth guarding, or is it stress?
It can be a combination of anxiety, many things, but getting married.
Yeah,
Yeah,
it can
that's
be,
it,
for
for
sure. Amazing. So, I want to play with you a little quick game, rapid fire game of truth or myth.
Okay. Myth would be like false? Truth or false?
Yeah.
Okay.
So you say like true or false. Teeth addition, obviously. So soft drinks thinning out your teeth, true or false? True. Drinking through a straw can help prevent teeth staining.
I would say yes.
From the front, maybe?
I mean, if you sip it versus like
With
drinking
a straw.
ranch, yeah, maybe a bit, yeah.
A little bit.
Yeah.
Charcoal toothpaste whitens teeth without damaging the enamel.
Absolutely not.
Once a tooth is chipped, it can repair itself naturally over time.
Not yet. They're working on products to maybe help.
Sugar is the only cause of cavities.
Myth?
It's a myth.
Yeah, I mean...
What else could cause?
Acidity?
Acidity? Yeah. Okay. Chewing gum after meals can help prevent cavities.
Absolutely.
Really?
Yeah.
Really?
If you don't have access to a toothbrush and a dental floss, it's from... it's basically... I can explain? Or?
Yeah, of course.
Because it's a sugar-free gum.
Okay.
That you got to use.
Okay.
There's xylitol inside, so it's sweetener, but it's sugar-free. So the bacteria that are normal inside your mouth will not be able to metabolize the xylitol, which is sugar-free, into acid.
Wow.
So by chewing gum, you're going to salivate more. So it has an effect of cleaning your teeth, right?
Fascinating.
Yeah, and acidity is from, let's say, turning the sugar into acid. So the pH, going back to chemistry, but it's going to be lower. So by having more saliva, you're going to stabilize the acidity level inside your mouth, and you're going to have less potential cavities.
Wow.
So if, let's say, somebody on their wedding day doesn't really have access, but is so hungry, eats a bit of chocolates, but doesn't have time to go brush their teeth, it would be a good idea to use a sugar-free gum to help.
To help.
Yeah.
Ziad, what's your last piece of advice for brides-to-be?
Dentistry-wise, consult your dentist ASAP for your health, not only for aesthetics. And be a good friend with your future husband. It has to be your best friend to thick and thin, they say. So that's it. No.
I love it. Thank you so much for being on Wedding Wednesday.
Thank you for having me.
Of course, please tell everybody where they can connect with you.
Yeah, if you want to connect with us, our website is www.centredentairemaçon.ca.
We'll put it on the
And our phone number is 514-728-4589. If ever you're interested, and me and my colleagues would be our pleasure to have you over. And
that's how they can book a free. That's how they can book a free consultation.
Yeah, absolutely. You have to say that it's for aesthetics, implants, or reconstruction. Even aesthetics, just whitening, so it's fine. And especially if you tell them you're coming from Wedding Wednesdays, it's going to be more than our pleasure to have you over. As I said, I'm there with my 2 colleagues, and this applies to all 3 of us.
Perfect. Well, thank you so much.
Thank you.
If you have any crazy wedding horror stories, we'd love to read them here on the pod. You can email it at hello@weddingwednesdaypod.com. Please rate, review, subscribe, do all the things because it really does help our podcast grow. And with that, I will see you in the next episode. Bye for now.
Ciao, ciao.